Hello, my name is Alexandra Tutwiler. Today's date is February 27th, 2022, and here is the sheet of paper that I will be using for today's presentation. So to start off, the syndrome that I chose to discuss in this presentation is adrenal insufficiency syndrome. The common clinical manifestations for this syndrome include chronic fatigue, weakness, muscle aches, loss of appetite or weight loss, fluid loss or dehydration, abdominal pain, nausea, vomiting, diarrhea, a low blood pressure that drops further when the patient stands up, which can lead to dizziness or fainting, irritability and depression, joint pain, hypoglycemia or a low blood glucose, and irregular or no menstrual periods for female patients. So if not treated, adrenal insufficiency may lead to severe abdominal pain, extreme weakness, chronic low blood pressure, kidney failure, or even shock. So other syndromes that occur within the endocrine system include Cushing's syndrome, hyperpituitarism syndrome, and then hypothyroidism syndrome. So to start off, Cushing syndrome can be differentiated from adrenal insufficiency syndrome because adrenal insufficiency syndrome is when the adrenal glands do not produce a sufficient amount of the hormone cortisol, so there's a deficit in the hormone cortisol in the patient's body, whereas Cushing syndrome occurs when your body has too much of the hormone cortisol over time, as a result from either taking oral corticosteroid medications in high doses over time, or the adrenal glands are just producing too much of the hormone cortisol over time. And then hyperpituitarism syndrome occurs when there is an excessive secretion or production of one or more of the pituitary hormones from the pituitary gland. This syndrome can be differentiated from adrenal insufficiency syndrome because this syndrome occurs when the adrenal glands do not make enough of the hormone cortisol, whereas hyperpituitarism syndrome is when the pituitary glands are making too much of one or more of the pituitary hormones. The last one, which is hypothyroidism syndrome, is defined as having an underactive thyroid, and this occurs when the thyroid gland does not make enough thyroid hormones to meet your needs of the body. And so these two can be differentiated using the diagnostic testing or how they're diagnosed. So adrenal insufficiency syndrome is diagnosed by using an ACTH or adrenocorticotropic hormone stimulation test to measure the cortisol levels in the patient's blood. Whereas diagnostics testing for hypothyroidism syndrome uses blood tests that measure TSH or the thyroid stimulating hormone, and then further testing can be done to measure the levels of the thyroid hormone thyroxine in the patient's blood. So 3 diseases or conditions that are included in adrenal insufficiency syndrome are Addison's disease, adrenal gland suppression, and congenital adrenal hyperplasia, or CAH. So Addison's disease is an autoimmune disease in which the immune system mistakenly attacks the body's own tissues or cells, and specifically for this syndrome, the body is going to attack the adrenal glands, causing them to not be able to make enough cortisol. And sometimes the hormone aldosterone, and this leads to primary adrenal insufficiency. Adrenal gland suppression is an inadequate adrenal production of cortisol due to suppression of the hypothalamic pituitary adrenal axis. And this condition causes the normal activity of the adrenal glands to be reduced when people are taking steroid medications such as prednisone, hydrocortisone, or dexamethasone. So when patients are taking these steroid medications, it's important to taper them off, especially when they've been taking them for an extended period of time, because it can cause the adrenal glands to be unable to produce the hormone cortisol or other hormones in sufficient amounts, which can lead to adrenal insufficiency if they're stopped suddenly. The last one is congenital adrenal hyperplasia, or CAH, which is a genetic disorder that affects the adrenal glands, which causes the adrenal glands to make an insufficient amount of cortisol, leading to adrenal insufficiency. And then finally, people with any of these conditions or with adrenal insufficiency syndrome are at risk for adrenal crisis because they have very low levels of cortisol in the blood. So adrenal crisis can cause diarrhea, vomiting, dehydration, low blood sugar levels, and then shock. So this is a life-threatening medical emergency that requires immediate medical attention. Thank you.